Welcome to the Pathways to Wellbeing documentation course, Entering Pathways to Wellbeing Eligibility in Cerner Community Behavioral Health, Client Categories Maintenance. This course is one in a series of learning opportunities designed to help familiarize you with pathways to well-being and continuum of care reform concepts, practice, and documentation. Pathways to Wellbeing supports youth by bringing together the child or youth and their family, behavioral health services, child welfare services, and other critical partners to support the safety, permanency, and well-being of youth involved with the child welfare system. As a behavioral health service provider in the County of San Diego, your responsibilities under Pathways to Wellbeing include creating and maintaining complete and accurate documentation of service activities. In this course, we'll focus on entering pathways to well-being eligibility in Cerner Community Behavioral Health, or CCBH. We'll cover these key concepts. What is the Client Categories Maintenance, or CCM tab, in Cerner Community Behavioral Health, or CCBH? When do you need to enter KDA class or KDA subclass designations and dates in the CCM tab in CCBH? How to access the Client Categories Maintenance tab in CCBH, and how to enter KDA class or KDA subclass designations and dates in the CCM tab in CCBH. Then we'll explore some situational considerations you need to make when the youth you're serving has either been discharged from another BHS program or is being served by more than one BHS program simultaneously. The County of San Diego utilizes CCBH Electronic Health Record for client service documentation and billing. The CCM tab in CCBH captures the current and past pathways to well-being designations, including the effective opening date and end date. All youth with an open child welfare services case, including voluntary services, must have their KDA class or KDA subclass designation entered in the CCM tab in CCBH. Please note that the CCM uses different terminology than what is typically used when describing pathways to well-being involved youth and does not match the terminology in other pathways to well-being documents. For purposes of clarity, this course will use the designation terms found in the CCM, KDA subclass, to describe youth designated as pathways to well-being eligible for enhanced services, and the term KDA class to describe youth designated as eligible for pathways to well-being. To access the Client Categories Maintenance tab, log into CCBH. Go to the Kokopelli at the top left-hand corner of the page. Select Menu. Select Client Data. Select Client Assignments. And finally, select Client Categories Maintenance. The provider is required to enter the KDA class or KDA subclass designation in the CCM tab in CCBH for all youth who have an open child welfare services case, including voluntary services. KDA class and KDA subclass designations in the CCM should always be guided by completion of the Eligibility for Pathways to Wellbeing Enhanced Services form. Please refer to the Eligibility for Pathways to Wellbeing Enhanced Services form documentation microlearning for more information on how to complete the eligibility form. Entry in the CCM is required at intake, reassessment, and discharge. Intake refers to the first 30 days in which a youth is open to a BHS program and includes when a provider has conducted their assessment and completed the Eligibility for Pathways to Wellbeing and Enhanced Services form. The program must complete the Pathways to Wellbeing eligibility form, followed by entering the KDA class or KDA subclass designation and the effective begin date within the first 30 days of a youth opening to the program. To enter a designation date at intake in the CCM, click the All Radio button whenever viewing data in the CCM in order to reflect all current and previous class or subclass designations. If there is not a current effective date for either KDA class or KDA subclass, click the column highlighted in green under Category. Click the magnifying glass. Select either KDA class or KDA subclass. Tab to the next column to save. Enter the effective date. Tab to the next row to save. Reassessment refers to whenever there is a change in the youth's KDA class or KDA subclass designation during treatment. When this occurs, the BHS program will complete the Pathways to Well-Being Eligibility form, enter an end date into the current designation in the CCM tab, and enter the updated KDA class or KDA subclass designation in the CCM tab. Pathways to Wellbeing designations cannot overlap in the CCM tab, so it is important to end the current designation before entering a new one. An example of when a youth's KDA class or KDA subclass designation would change is when a youth that was previously determined to meet KDA class criteria is psychiatrically hospitalized while open to a BHS program. The youth in this example would now meet the criteria for KDA subclass. To enter an updated designation date in the CCM, click the All Radio button whenever viewing data in the CCM in order to reflect all current and previous class or subclass designations. Enter the end date on the same row that currently displays either KDA class, Pathways to Wellbeing Eligible, or KDA subclass, Eligible for Enhanced Services. Tab to a new row when entering the new designation. Note, never delete any information in the CCM. Click the column highlighted in green under Category. Click the magnifying glass. Select either KDA class or KDA subclass. Tab to the next column to save. Enter the effective date. Tab to the next row to save. Discharge refers to when a youth is no longer receiving services from your BHS program. The BHS program is expected to complete the Pathways to Wellbeing Eligibility form and enter an end date for the KDA class or KDA subclass designation in the CCM at discharge. The end date needs to be entered regardless of whether the youth continues to meet KDA class or KDA subclass eligibility. The end date should match the youth's discharge date, also known as the assignment end date from the BHS program. When a youth is receiving services from a single BHS program while still eligible for KDA class or KDA subclass, the program should engage in a warm handoff and or connect with the Child Welfare Services Protective Services worker to ensure the youth is receiving appropriate services. To enter an end date designation at discharge in the CCM, click the All Radio button whenever viewing data in the CCM in order to reflect all current and previous class or subclass designations. Enter the end date on the same row that displays either KDA class or KDA subclass. Tab to the next row to save. Some helpful tips to remember. Always click the All Radio button whenever viewing data in the CCM in order to reflect all current and previous class or subclass designations. Tab to the next row to ensure information is saved. Always tab to a new row when entering a new designation. Never delete any other program designations or dates in the CCM tab. KDA class or KDA subclass dates cannot overlap. Let's explore the different considerations to be made under these three situations. The youth is receiving services from more than one BHS program, and the programs agree on the youth's designation. The youth is receiving services from more than one BHS program, and the programs do not agree on the youth's designation. And the youth is receiving services from only one program, and there is a current effective date for either KDA class or KDA subclass designation. If there is a current effective opening date for either KDA class or KDA subclass at intake, And through collaboration between programs, there's agreement on the current designation. Keep the KDA class or KDA subclass designation and effective date as is currently displayed in the CCM. When there is a current effective opening date for either KDA class or KDA subclass at discharge from one program while remaining open to another BHS program, collaboration between programs will occur to reach agreement on whether the youth continues to meet the current designation. Upon agreement, keep the KDA class or KDA subclass designation and effective dates as is currently displayed in the CCM. If there is a current effective date for either KDA class or KDA subclass, and there is not agreement on the current designation, there needs to be collaboration between BHS programs to reach agreement. Programs can determine if there is another program currently providing services by looking under the Assignments tab in CCBH. Programs can also locate another BHS provider's contact information by following these steps. Click the Assignments tab. Double-click the open assignment. A window will pop up displaying the primary server. Click the plus sign on primary server to obtain provider contact information. If there is a previous effective opening date for either KDA class or KDA subclass without an end date, and no other BHS program currently providing services to the youth, please contact the Pathways to Wellbeing team to request that the Pathways to Wellbeing team enter an end date. Once the end date is entered by the Pathways to Wellbeing team, the BHS program will be contacted to enter the KDA class or KDA subclass designation and appropriate effective opening date. The Pathways to Wellbeing team roster can be found on the Pathways to Wellbeing and Continuum of Care Reform page on the RISE website under Contact Us. The site URL is displayed on the screen. All youth with an open Child Welfare Services case must have their KDA class or KDA subclass designation entered in the CCM tab in CCBH. In this course, you learned how to access the CCM tab and when you are required to enter KDA class and KDA subclass designations and dates. You received specific instructions on the processes for entering designations and dates at intake, after reassessment, and at discharge, and reviewed specific situational considerations to bear in mind when the youth receiving services has either been discharged from another BHS program or is being served simultaneously by more than one BHS program. We encourage you to review the other courses in this learning series. Thank you for attending this course.